I'm Suzanne England. I'm a member of the GateHouse Media Wellness team. Welcome to Simply GoodLife Snippets. Simply GoodLife Snippets is a series where we will introduce you to benefits, activities, and services to help you and your family get well and be well. Today, we're going to talk about how to become a savvy healthcare consumer.
Items we're going to cover today include: what does consumerism mean? Transparency in healthcare, barriers to being a healthcare consumer, the idea of price versus quality in healthcare. We're going to provide you some real-life examples of differences in medical costs for the same service at different facilities, and then we'll finish off talking to you about various resources where you can become more educated and find out about different prices for similar healthcare services at the same level of quality. So, let's discuss consumerism. What does this mean? Patients have the opportunity to compare prices and quality of healthcare services and ultimately choose high-quality care, but with a lower cost. Transparency is when consumers have the information necessary from those selling goods or services to know the full cost of what they are buying and what that product or service will include. In healthcare, it means making available to the public reasonable and understandable information on the quality, efficiency of the consumer experience, and full price in an effort to allow the healthcare consumer to make the most informed decision regarding their care. Unfortunately, there are several barriers to providing healthcare consumers with full healthcare transparency. The technical barriers include things like pricing data not easily available to patients or providers. Many providers are still paid by a fee-for-service model. This means that services are unbundled and paid for separately. And healthcare, it gives an incentive for physicians to provide more treatments because payment is dependent on the quantity of care rather than the quality of care. Said differently, physicians will receive compensation for each service they provide. Moreover, many times when patients ask providers or for facilities for the cost, they are unable to answer the question as they are not fully aware of what the charges will be for the service. The final technical barrier is prices can vary widely depending on insurance contracts, location, and sometimes for completely unknown reasons. In addition to technical barriers, there are a number of emotional barriers that also exist to being a savvy healthcare consumer. Patients may associate higher cost with higher quality. I think that's something we've all been guilty of. We're under the illusion that if we pay more, we're going to get a better quality service. In addition, patients often depend on the recommendation or referral of their providers or their own physicians and may not ask for a second opinion or comparison shop to see if the service can be performed by another high-quality facility or doctor, but for a lower cost. As a savvy healthcare consumer, it's very important to know that higher price does not always mean higher quality. As we touched on earlier, costs for medical services are sometimes based on the location of the facility, the negotiated contract with certain insurance carriers, or can be just what the practice has chosen to charge for a given service. As we will show in the next few examples, by shopping around, patients may find that they can receive the same high-quality treatment for a lot less money. Considering that most medical plans have deductibles built in, allowing yourself to learn about what options you have will help you feel more empowered in your healthcare choices and can save you money. In this first example, a patient needed an MRI of a knee in Austin, Texas. As you know, an MRI is a picture of a knee under a microscope to determine if there is a tear or breakage or some other type of degenerative breakdown. The picture will serve as a tool to help the physician make a better diagnosis. Now, as you can see when you look between these locations, there is a significant price differential between the quoted price for the exact same service. In the next example, we take a look at Providence, Rhode Island. Again, these locations are not significantly far apart, but the price differential is huge. It's almost 7 times the difference. Next, we go to St. Louis, Missouri, where we'll take a look at a knee surgery. In this example, we're going to show you your pricing if you had already met your deductible and you were on the GateHouse Media individual plan for the consumer-driven health plan. At Barnes Jewish Hospital, you would be responsible for $1,420. At the Old Tennyson Surgery Center, you would be responsible for $450. This is because even after you've met your deductible, you are still subject to coinsurance or co-pays depending on the plan and the specific requirements of that plan. In addition, even when employees have hit their out-of-pocket maximum for the year, it's critically important to continue to be a savvy healthcare consumer. By finding the best services at the best possible prices, it helps keep healthcare costs down, which allows GateHouse Media to work on keeping your healthcare premiums from escalating. Now, since it can be really confusing to be expected to be a savvy healthcare consumer, and it's not as easy to find the costs or to make sure that even if you find a great cost, that facility still has a high quality rating, we have supports available for you to be able to make the best decisions. Employees enrolled in the Excellus Blue Cross Blue Shield plan through GateHouse Media are able to contact TouchCare for assistance in comparing costs and finding providers and facilities that have great reputations with fair prices. Not only can TouchCare help with this information, but they can answer specific benefit questions, they can schedule appointments for you, and they can help you understand and solve billing questions should they arise. Another resource is provided through Excellus Blue Cross Blue Shield plan for members. On their member website, in the resources section, they have a cost estimator. If you'd like to use any of these tools, please just call the number or visit the website listed on the screen. So just to reiterate, some examples of when to use TouchCare are if you're referred for surgery or testing, if you're referred to find a specialist, if you're looking for any in-network physician or provider, to prepare in advance for an emergency or urgent situation related to your health care and you'd like to know facilities and potential costs in your area, billing questions, benefits questions, or scheduling assistance.
Thank you so much for joining us today. If there's one piece of information that you take away from this video, it's that you have tools and resources to be a savvy healthcare consumer. It's important to keep in mind that the costs that we incur in our medical plan affect us all, regardless of the plan in which you choose, since we'll all end up paying higher premiums if we're not mindful of the costs. At GateHouse Media, we want to ensure that you have access to high-quality care, but you have tools through TouchCare and Excellus to shop around to make sure that you're also getting the best price. Thank you once again, and make sure you check out the other videos that we have available for you.